And most of what we have done previously has been really achievements in liver transplantation. But I'm very much a liver surgeon, or really have had more interest in liver surgery than liver transplantation. But liver transplantation is a much more high-profile thing in India, and everybody gets excited with liver transplantation rather than liver surgery. Now, we have a fairly large program of liver resections for cancer. I think whenever liver resections is possible, that should be the first line of treatment rather than liver transplantation, because liver transplantation is a very expensive operation, and it's got a lifelong commitment with immunosuppression. Obviously, there are very clear guidelines as to who are the patients who should have liver resections and who are the patients who should have liver transplantation. And sometimes liver resections are necessary whenever liver transplantation is not a indication, like in this case. People might think, why couldn't you do a liver transplantation in this situation? But patients sometimes don't do better with liver transplantation, they do better with liver resection. So I wanted to introduce this concept of the possibility of operations for liver cancer, which does not include liver transplantation. Now, there are many, many people in this country who are struggling with what treatment options are available around the country. And in some respects, actually this liver resection operation, which may sound a much simpler thing than liver transplantation, is much, much more difficult technically and much, much more demanding, and surely much more riskier than liver transplantation, because particularly in patients with cirrhosis, this is an example of a gentleman who's been suffering from liver disease and hepatitis B for a long time, which is why he formed the liver cancer. Many people would just say, in a patient with cirrhosis, liver resection is not possible. And it's fraught with danger because the liver can fail after the operation. So there are many instances where patients have undergone an operation, they open the abdomen and find that the liver is diseased and they close up. And some of them can't even have liver transplantation. So what I want to convey really to you and to the public is that liver resection is complicated, and it needs to be offered in centers of excellence where even the facilities are greater than liver transplantation. And it's not compared to liver transplant, it's not an expensive operation. Maybe some hospitals may not think that it is important to develop these services to such high levels. And I just want to recall this gentleman when I went to see. I just want his son to really give some talk about it actually, how they feel. This is an example of a patient who's gone around everywhere and have had many opinions from different doctors. And most have said nothing is possible. That, you know, when you mean nothing is possible, they're actually telling you to go home and, you know, wait for the eventuality. And there are some who said that maybe we can attempt it. And he's had an attempted operation before he came to us. It's been opened up and then closed because it was bleeding everywhere when they opened up. So it's important for patients and the families to understand that there is this option available, and in today's world it's very easy really to find out where these can be done and how well these can be done in other places. And he's an intelligent young man, I think, so he came to see me with the x-rays. And then I said that it is possible to operate on this. And he's gone through it. And things have gone well, and we hope that in the long term, as you all know, that cancer is something that nobody can say at the end of an operation that it is successfully treated. It's been successfully removed, and he will need long-term care and follow-up, because these tumors can form other tumors in other parts of the liver, and which need to be diagnosed earlier rather than later, like in this case. I just wanted to tell a story. I was just speaking to the son about it, that Many families and patients are in a kind of a predicament when they don't know what is happening. They go from doctor to doctor and they get many different opinions, which for you as lay people may be a bit of a surprise. Maybe that's why you go to different doctors, and you may find that every doctor gives a slightly different opinion, whether about the operation or about the prognosis. And you have to assume that when that happens, it's a difficult case. For most cases which are straightforward decisions are made. And people will go to a doctor, they'll say it requires this treatment. You go to 10 doctors, maybe 9 out of 10 will say this is the treatment. Maybe there is one doctor who might be a bit crazy and have a different opinion. But when cases where you go to different doctors and you get different opinion, and some opinions like there is nothing which can be done, patients really have a hard time. That they've met 9 doctors who have said that nothing can be done, and the 10th doctor says, actually we can remove it. They will become suspicious, actually, with the 10th doctor who says it can be removed. And I've come across this many times in my life, and I always wonder what actually makes them trust what I've said. One may be just desperation, because everybody else has said, oh, nothing can be done, and this guy is saying. And a sensible person actually shouldn't think that this is a sensible guy, because 9 out of 10 have said that it's not possible. I don't know if you're all listening to stories that I'm telling. So I was just telling him this morning that what made you think that, because the patient was not there, he came with the reports from Bangalore and spoke to me, and I said, I think it's possible. And what makes people believe what you say, apart from maybe desperation, which brings you to the last person who will offer, because there are many instances that Ayurvedic doctors or somebody will offer a cure when 100 doctors have said nothing can be possible, people will still go there. I'm not one of those Ayurvedic doctors anyway. I'm offering the same treatment that others have said is not possible. So it's sometimes people will come back and tell me something like, the example I was giving him is, I had a patient in London from Canada, and everybody had said that nothing can be done, and finally they landed up with me, and I said, something can be done, and I also said that it's possible for this patient to live long term. And then that conversation went, and I wasn't sure if they're ever going to come back from Canada for the treatment, but they did come back for treatment. When I said, why did you come all the way for treatment when 10 doctors have said nothing can be done? She said to me, doctor, when you were leaving, we were in the reception, and you said everything would be okay, and I would hope to see you every Christmas, because it was Christmas time, for a follow-up in London. And she said to me, a doctor who doesn't believe what he said before wouldn't actually say something like that I'll see you back for Christmas, because if you didn't believe that this patient is going to make it good, you wouldn't say something like that. So I wanted to explore that to say, why did you bring him actually to Chennai when 10 other doctors have said nothing can be done? Maybe he should say why he felt that. I think I'll finish that. So it's important that families explore the possibilities of options, and treatment is available. It's not like it was in the olden days when nothing can be done. Obviously I do see many patients where nothing can be done as well. I'm not saying that I'm a hero which can treat every patient. We cannot treat, but hopefully there will be more and more treatment available in the right sort of facilities, with the right sort of doctors, with the right technology. We can offer high-end treatment. And this tumor, I mean, everybody was saying, what does this mean? Successfully removed the largest cancerous liver tumor ever reported. I'm sure our people were going to say, ever reported actually means largest tumor ever removed in the world. Actually, it is true. It's the largest tumor ever removed in the world, but technically it may be false, because somebody may have removed a larger tumor that we don't know about. So that's why I said I don't want to call it, this is the largest tumor ever removed. Potentially it could be, but nobody else has reported removing such a large tumor. So you could assume that this is the largest tumor ever removed in the world, but nobody can be 100% confident that there may be somebody who may have removed it but not reported it, which is why we call this what it is this way.
This is a common வியாதி. லிவர்ல வந்து சிரோசிஸ் அப்படிங்கிற ஒரு பாதிப்பு ஏற்பட்டுச்சுன்னா இது வந்து வைரஸ்னால வர வியாதி. லிவர்ல கேன்சர் வரும். முக்காவாசி பேருக்கு முடியாதுன்னு சொல்லி கடைசியில் சென்னைக்கு வந்து இந்த ஆப்ரேஷன் பண்ணி இப்போ நல்லா இருக்காரு. நான் இங்கே முதல் தடவை என்னை பார்க்கும்போது இவர் வீல் சேரில் தான் இருந்தார். நடக்க முடியாது, ஒன்றுமே உடம்புல ஸ்கின் அண்ட் போன்ஸ் தான். இப்போ பார்த்தாலே உங்களுக்கு ஸ்கின் அண்ட் போன்ஸ் மாதிரி தான் இருக்குது. ஆனால் இது வந்து எவ்வளோ தேவலாம், ஆப்ரேஷன் முன்னாடி இருந்த நிலைமைக்கும் இப்போ இருக்கிற நிலைமைக்கும் எவ்வளோ தேவலாம். யூ அண்டர்ஸ்டாண்ட் தமிழ்? ஃப்யூச்சரில் எப்படி இருக்குங்கிறத நம்ம ரெகுலராக ஃபாலோ அப் பண்ணி எதுவும் ப்ராப்ளம் இருந்ததுன்னா டைமுக்கு ட்ரீட்மெண்ட் பண்ணால் எல்லாம் நல்லா வரும்னு நினைக்கிறோம்.
Wasting 1 month of time. I think that is the message I want to convey. Thank you.
I don't think that's not a routine case. So the advice would be that don't give up.